Hello, guys. Good evening. I'm Alam from the Mental Health, and today our topic is borderline personality disorder or personality disorder. What is borderline personality disorder? How it affects individual mental health in life? Borderline personality disorder is also called BPD, which means borderline personality disorder. Borderline personality disorder is a mental health condition in which a person is scared of being abandoned, being rejected, or a pattern of unstable, extreme relationships in which the person can be really impulsive, angry, or harming others themselves and being threatening to themselves or others. This extreme impulsiveness and self harming thoughts make other people run away from them. At a time, they can go to the very extreme to have this kind of control or feelings of control that they don't feel abandoned or being rejected. This make this makes them for them very challenging or hard to maintain normal relationships with people or normal kind of social communication with people. At a time, they can feel someone likes them. At a time, they feel someone doesn't like them. Or in a relationship, at a time, they feel the relationship is perfect. At a time, it is not perfect. Or feeling empty, abandoned, or being rejected. This constant attention seeking, appreciation, and making things certain constantly makes the individual company or spouse tired, exhausted. These people have extreme challenges in life to focus on their goals or do jobs because uh, this impulsiveness can be triggered by a very small, minor thing. It could be from a person, a company, spouse, uh, friends, or parents, some siblings. It can be anyone who are closer to them. And this kind of impulsive response, what they give, make people run away. It makes very challenging for them to have normal relationships with people. They have challenges at schools, studies, pursuing their careers. At a time, they feel very impulsive, sabotaging their good jobs, quitting jobs, and doing harmful things to themselves. They can be controlling for the person in a relationship or harming others emotionally or physically. So, and at a time they can go to the extreme, they can have suicidal thoughts or threatening thoughts to others or to themselves. So, how how to diagnose these people or what are the symptoms? So these are the main symptoms: impulsiveness, unstable relationships, anger, self-harming thoughts, being abandoned, rejected, a pattern of unstable relationships. These are common symptoms these people are experiencing. What causes personality disorder or borderline personality disorder? There are many types of personality disorders, but we are now specifically talking about borderline personality disorder. So I'm not going to details to differentiate it from one borderline personality disorder to other. Borderline personality disorder, uh, every person, not necessarily as impulsive as the other one. These impulses and these kind of behavior patterns can be different in different individuals. But as the time passes, a individual gets mature, getting experiences in life, they can be a little calm. They can learn skills how to control their impulsiveness in behavior. But they can be very, 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 very dangerous at a time, especially if they have a history of violence, childhood of violence, or they have experienced some violence in the past. This a small minor thing can trigger this behavior, and they can do things like this. So the most important thing to communicate with these people is be calm, listen, don't respond, don't reject, don't criticize. These are very important things while communicating with borderline personality disorder people, because your words, your behavior matters. Because if you are a normal person, you know how to control your impulses, how to control your behavior. Dealing with personality disorder person can be very challenging, because they trigger in you the similar response they want from you, because they don't have this kind of control to control their behaviors, their impulses, anger, and this can just come like this. So what causes personality disorder? What are the main causes of personality or borderline personality disorder? There are many causes. It can be a traumatic, from a traumatic childhood, violent childhood, sexually abused, abandoned during childhood, genetical reasons. Some people who have family history of borderline personality disorder. Also, this change in brain chemistry. Some researches show that this change in brain chemistry in the brain, this area where we control our behavior, our impulses. When something happens, injury or other something serious to that area in the brain, which can trigger borderline personality disorder symptoms or behavior. Because sometimes people in life do things which are very risky. They have this kind of impulsive behavior. They do things. So people who have borderline personality disorder, their mood can go from very extreme to extreme low, extreme normal, better, worse, anger, then again normal. So the mood is swinging. And as the mood swinging, relationships are also in balance. They can give really good feelings at a time. They can just drill you down to the dust, and they can be really controlling and impulsive because they're scared that you might leave them. So people who are in this kind of situation themselves are being with someone who has borderline personality disorder. It's necessary to communicate. I mean, communication in a way which doesn't trigger these symptoms of anger, impulsiveness, and violence, because the communication is very important. these few skills, it's very important to learn, such as like listening. Listen, don't criticize, don't uh, say things which might trigger them uh, to think that you are leaving or you are rejecting or something like that, because these things can trigger these symptoms and can be very angry response or very impulsive. Also, these people have drugs, can can have drug problems, gambling, or some kind of other violence in life. But I have personally seen people in life who are living normal life, working, have balanced relationships, normal life, doing things normally. They are diagnosed with borderline personality disorders. But the thing is this: these people know their they have learned skills how to control their behavior. They are doing healthy things, exercising regularly, taking medication, are doing things which make them calm, like such as heavy physical exercise, normal people relationships, good friends, good things in life. Like medication is not always the solution that people take medicines. Medicines are just controlling the timely symptoms, are calming a person's impulses, are anger, behavior. So it's for a time being, but for long term, people with borderline personality disorder, they need healthy people relationships, therapy, psychotherapy, or some kind of therapy that they can learn skills in this therapy so that they can control their behavior, can have normal relationships with people. So I advise to people who are in this kind of situation in life, who are diagnosed with borderline personality disorder, or who have spouses, family members, friends, or relatives who have been diagnosed with borderline personality disorder, don't hate them, don't criticize them, don't reject them. Be there, listen, don't criticize while you are listening. Don't make strong opinions. These are important skills to learn while communicating with these people, because these people are really sensitive and they can be really caring also, like these kind of people who have borderline personality disorder can be really very caring, loving, honest. They can be are usually sensitive people. They can be very humble, nice, kind too. So they have also like good things there. So to communicate, it is very, very important to be humble. Listen, don't reject, don't make strong opinions to them. Just listen. This listening is very important. And learn these skills, and I'm sure you can manage to communicate and be in a normal situation, while the situation might be sometimes intense, but you can turn it to normal if you communicate and you learn these skills. So thank you for watching, and let's talk about these topics. This topic next time. We will continue about other issues. People are having mental issues, stress, depression, are challenges in their life, normal life. So I'm gonna be giving pre-coaching on my YouTube channel, and remember to join my channel on YouTube. You will be watching free videos, coaching, and advice for mental health, how to maintain your personal mental health, and also have normal relationships with people. So thank you for watching. Have a nice evening for you guys, and talk with you next time. Thank you. Bye for now.